So, hi, I'm Dr. White, and I'm
Hello.
your doctor today.
Hello there.
Could you tell me could you give me your full name, please?
My name is Doug. Doug Matthews.
Doug Matthews. And how old are you? How old are you?
I'm 31.
31. And what do you do?
I'm unemployed.
Unemployed. Okay. And what brought you in to see me today?
Well, I'm actually come just about my knee, just for a checkup.
Which knee?
The right knee.
Right knee. So, any pain in your knee?
Well, I've sort of ever since sort of the injury, just been struggling a little bit with walking upstairs and just not being able to walk too far.
So, when did it start?
Well, this is my accident was 3 years ago. It was a motorbike accident, and ever since then I've just not been able to work. So it's been since then really.
And where is the pain exactly?
It's just over the whole knee really. Just the whole knee.
Can you describe the quality of the pain?
It's like a dull ache.
Dull. And if 0 is no pain at all and 10 is the worst pain ever, could you rate your pain?
It's probably about a 3.
3, so it's not too bad. Okay, is there anything that makes the pain better or worse?
Well, if I sit for long periods, it's worse, and as I said, walking
If you
upstairs.
sit, it's worse. Okay, so
Yeah.
you should move around. But, no? Yeah?
Yeah, I mean, but yeah.
Okay. And is there any swelling, any fever? No.
No, nothing like that.
And I guess you know what's the cause of your pain. It's your injury. Yeah? And your concern is...
Well, I just wanted to come have a checkup here.
Yeah, but I mean, was everything done for your knee in the past?
Yeah, I was in kind of hospital for a while.
So do you have any more pain nowadays, or are you having any more problems than the past? Or, I mean, I just want to understand why you have come to see me today for your knee.
Well, I mean, the truth is it's a bit embarrassing sometimes, but I've really struggled since I've sort of come to Melbourne.
Yeah, where did you come from?
Just a sort of a small town in New South Wales. And I had to come here because sort of I had to look for work.
Yep.
There's no work there in where I come from. So yeah, and then at the moment it's just really been difficult getting a job. Just send in applications and get rejected, and
any past medical history such as cancers, hypertension, diabetes, anemia? No. What about your family? Do you have family, parents, sisters, brothers? Are they alive?
They're still in back home.
Good. Yeah,
but
are
I miss
they
them,
healthy?
Yes.
And any sisters, brothers?
Yeah, but they're all back home.
So, do you smoke?
No.
Alcohol?
Occasionally, yeah.
Have you ever smoked or drank alcohol?
Yeah.
Yeah?
Yeah.
Okay. Any illicit drugs?
No, nothing. Yeah.
Good. So, do you still smoke?
No, I don't have.
No. Probably
No.
can't afford it, or...
Yeah, I can't afford it really.
It's good. I mean, better for your health,
Yeah, well, that's what they say.
Yeah. Who do you live with?
I live with a flatmate.
Good. So, do you have friends here?
Not really, no.
Any financial issues?
Well, as I said, I'm sort of unemployed.
Yeah, but you don't get any money from Centrelink or...
Yeah, there are some benefits, I guess.
That's good. Any religious beliefs, spirituality? No. Okay. What about your diet?
I eat what I can get.
Yeah.
So,
Okay. So fruits, vegetables.
Yeah, whatever's going.
Yeah.
Yep.
Okay. Good. Exercise? Do you exercise?
No.
No. Yeah. Why not?
Well, don't feel like it.
Okay. So what do you want me to do for your knee today?
Well, I just wanted to check up on. The last doctor I went to was here, and she was from the country, and she was really nice. And I was just wondering whether you could just have a look at my knee.
Yeah, I'll have a look at your knee. Yeah.
I just wanted to chat about sort of other things.
Yeah, such as.
Just really struggling just to get here. It's I don't know. I just don't know where to start. It's
Yes, I'm listening. Yeah.
my family, as it was all there, and I just miss them. I'm struggling to find a job.
But this is normal. I mean, everyone who comes to the city from the country,
It's
they
just-
may, yeah.
It's not like that. It's you know. And then my usual company was my dog, and my dog died 2 months ago, and it's just never been the same. It's
What dog is it?
her name was Sparkle, and she was like a Maltese.
Are they small dogs?
Yeah, it was just almost
Yeah,
small
I
dog.
think they have a big coat, thick coat.
Yeah, sort of.
Yeah,
Maltese,
well, can't you buy another one?
it's just not the same. It's just not the
I
same.
think they all look the same, and maybe you will forget about the previous one when you buy a new one.
I don't know. It's just I don't know what to do.
It's just a dog, and it can be replaced easily, and if you love dogs, that will be fine. Now, with your knee, do you think we need to have an X-ray done on this knee, or just
I don't know.
I better have a look at it first and see whether you need one or not?
Okay, whatever you say. Yeah.
Yes.
Yeah.
And you need to think about some solutions for your loneliness, and you don't want to end up having depression, and in addition to your other problems. Yeah.
Okay.
Okay. So I'll have a look at your knee and see what we can do. Hi, Doug.
Hi.
I'm Jill White. I'm your doctor today. So could you tell me your name, your full name, please?
My name's Doug. Doug Matthews.
Doug Matthew. And how old are you, Doug?
I'm 31.
And what do you do?
I'm not working here. I'm unemployed.
Unemployed. That's fine. And could you tell me what brought you in to see me today, Doug?
Well, it's sort of my knee, because of my knee really. I had a bit of a fall at home.
When was that?
Just the other day really. And since then, it's really been hurting. And just struggling a bit.
Which knee is it? Is it
It's
the right knee?
my right knee.
Only your right knee.
Yeah.
And could you tell me where is the pain? Could you show me?
It's just all over.
All
just
over.
all over, yeah.
Yeah. Is there any swelling?
No.
No. And you said, did you have any pain before that?
Well, I actually sort of had a sort of an injury. I fell off a motorbike 3 years ago. It was quite a bad accident, and had to go to hospital, and it was broken as well.
So did you have a surgery?
Yeah, they had to. I had to be taken to theatre, and it's been okay. And just since when I had that fall, it's really.
So are you able to walk on this knee?
Yeah, I am. It's just sort of when I walk upstairs or walk along, then it starts to ache.
So is the pain worse during the day or at night or when you walk on your knee?
It's mainly when I walk, really. So mainly in the day.
So at night, no problems?
Not really, no.
Okay. And could you just describe the pain for me, and let me know whether is there any difference between the pain now and the pain before the fall?
Yeah, it's sort of it's more of a sort of a dull ache. It's not always there. It sort of comes and goes, and it's just really worse when I walk, particularly upstairs, and when I sit a long time. And it's not the same. It's just not the same.
And just if I'm going to ask you to rate the pain for me. So 0 is no pain at all, and 10 is the worst pain ever. So could you rate your knee pain?
Well, it's probably only about a 3, I think.
3. And how was it before the fall?
Well, probably about, maybe even 0 to 1. Maybe, yes.
And are you on any medication for this pain?
No.
No. So I've already asked you if there is any swelling, any rash.
No, nothing like that.
Nothing. It's just this pain.
Yeah, just the pain.
And what do you think is causing this pain other than the fall? Is anything else that you believe is causing this pain?
I don't know. It's a bit embarrassing to talk about.
Well, I can see that you feel upset a bit.
I'm just more embarrassed, I think. I'm sort of new to Melbourne.
Yeah.
And so I've only been here for 6 months. I had to come to Melbourne because for work. But it's really been difficult, just you send in applications and then they just get rejected.
So where did you come from?
A small, really, just outside, sort of a very small farm outside Dubbo in New South Wales.
How far is it from Melbourne?
Oh, it's good distance. That's a good distance.
And do you have family there?
Yeah, they all live there. So all my mom, dad, and brothers and sisters too.
Okay, I just need to ask you a few questions about your past history. So any previous illnesses before, childhood illnesses, injuries,
Nothing.
other
Nothing
hospitalizations, no hypertension, no diabetes?
No,
nothing.
Nothing like that.
Yeah. Again, I need to ask you about your family. So are your parents all right, healthy, or
Yeah, well,
any health issues?
I think
in
they're
your family?
good. They're good.
Any sisters or brothers?
Yeah, two brothers and one sister. And they're good. They still live outside.
Okay, so I need to ask you a few more questions about your smoking, alcohol, and if you're taking any medications. So do you smoke?
I don't smoke.
You don't. Have you ever smoked?
No.
No. Good. What about alcohol?
Now and then, just over the weekend. Yeah.
So how much?
Probably maybe 3 beers over the
Beers?
weekend. Yeah.
What beer? Strong?
Just normal sort of. Yeah,
The
cans.
normal, yeah. Okay, over weekends only?
Just over weekends. Yeah.
With friends? Do you have friends?
I don't really have friends since I've come to Melbourne, so mainly just drink on my own.
Okay, now I'm going to ask you a question which is just, that I need to clarify a few things. Have you ever tried any illicit drugs?
No. I wouldn't do that.
All right. Do you use any other medications? I mean, like over the counter?
No, I haven't.
Not even Panadol?
Sometimes, but
Sometimes. No vitamins, no herbal
nothing.
medications?
I just can't afford it now.
Yeah, I can understand. Yes. And where do you live? In Melbourne?
Just in the city.
In the city?
Sort of share a flat with Peter. So yeah.
And are there stairs in the flat?
Yeah, there's stairs to get to.
So do you have problems?
Yeah, I do. I
Yeah.
just find it really when I get to the top, it's tough.
Any financial issues?
Well, I don't work, so I get some benefits. But I have to just for I really have to get back to work because I used to enjoy working.
Do you exercise?
No,
No.
not really. I just don't have to.
What about your diet?
Oh, I'll eat whatever I can. Whatever's going.
Like,
Well, a bit of whatever. Pizza. A bit of sometimes a burger.
any fruits, any vegetables?
Yeah, I try to. It's just sometimes quite expensive.
So you mentioned that you don't have any friends or family in Melbourne?
No, that's part of the issue I wanted to chat about is I just feels quite isolated. It's just not been the same. It sounds quite embarrassing, but my dog, she died 2 months ago, and it's just not been the same. I know it sounds silly, but
No,
It's
it's
just
not
never been
silly.
the
I
same.
mean, I can see that you are upset, and I can really understand why would you be upset. Losing a dog is not an
she
easy
just
thing. I mean,
she
it's
just
a
reminds
friend.
me. Yeah, she just reminds me of home.
What was her name? Or his name?
Sparkle.
Sparkle. Was
yeah.
it a she or a
She,
he?
she, yeah.
Yeah.
And it's just nice when you come home and there's somebody waiting for you.
I know.
I miss that now. I just,
Yeah.
it's not the same.
Yeah. I can understand. Okay. So, what do you do? What other hobbies?
Not really anything. I mean, now I'm trying to look for a job, as I said, but mainly it's just sort of watching TV and playing a bit of PlayStation, and that's about it. Not much.
Yeah. So I'll have a look at your knee now, but it seems that we also need to have a look at some other issues.
Okay, that sounds good.
Yeah.
So Doug and I are now going to have a conversation regarding how those consultations went. Doug, how did you feel from the patient's perspective?
Well, from the sort of my first consultation, I had a problem, but that wasn't really I had sort of a hidden agenda, and it was sort of embarrassing. Didn't really want to talk about it, but I felt that the doctor wasn't really listening to me. So eventually I just agreed with her.
Okay. So you felt that your presenting complaint wasn't adequately delved into?
Yes, I was just sort of, I thought it is an embarrassing thing that I had to come in for, but I felt that she wasn't really listening to me. And I was quite frustrated.
Okay, right. And from the observer's point of view, there was a few things that we noticed, namely the closed body language, which the doctor used, the lack of eye contact. She used quite closed questions, didn't allow you to expand on what you were trying to say. She was interrupting your answers. She was very disease-focused, and she wasn't actively listening. She was quite distracted during the consultation. And she got through the questions for taking the history, but she didn't really delve deep enough into the hidden agenda. Would you agree with that?
Yes, I totally agree with you. And as I said, I felt sort of quite frustrated still.
Okay, great. And moving on to the second consultation, how did you feel with the doctor that time?
Well, I still had, obviously, she was very, she smiled at me from the outset, which sort of changed everything and I knew that she was warm and friendly. And she seemed, as I said, she wasn't interrupting me. She let me talk. And that letting me talk allows me also to bring up my embarrassing complaint as well. So she was a very different, and I felt also that she was a lot listening to me. And it was a very different feeling to the whole consultation.
Yeah. Doug's identified quite a few things which we observed as well, namely that the doctor in the second consultation had extremely good open body language. She had excellent eye contact, asked open questions, except for in the relevant areas like your past medical history. She let you talk and at the same time left silences in the consultation so that you were able to fill them if you felt it appropriate. She was actively listening, so she was leaning forward, sitting without a barrier between you and her. And also she was very respectful, and she repeated your cues and led from them, and also offered agreement whilst you were speaking. So overall, I think we can notice a stark difference between the first and the second consultation.
Mhm.